it's Stacey. Okay, so it has been quite a while since I have filmed a video, and honestly, it feels kind of weird because it's just been so long since I filmed a video. No makeup as usual. There's Foxy Bear chewing on a bone. Here's Phoenix, and yeah, I'm actually in the it's actually our front bedroom that I turned into my office. And it's actually funny because if you want like an office tour, I will totally do one. But what I did is I took everything out of the actual closet and put my desk in here and decorated it, and so I've got like tons of stuff in here. It's awesome. So anyways, don't mind me. I'm basically giving y'all an update. And y'all know I always play with my hair. I'm sorry. It's just, I've done it since I was like young. Like I just have. And I'm really nervous right now. I'm extremely anxious. I'm having a surgery in the morning. It's not a big surgery, but I'm still incredibly nervous. Okay, so here's just an update on what's going on. So, last time I talked to y'all, I had an endoscopy, which I'm pretty sure I told y'all that, I don't know if I told y'all, but anyways, they, because of all the, like, anxiety slash could be used as depression medication I take, I'm really hard to sedate, so, they normally just give you Demerol and something else, but they gave me Phenergan first through the IV, and then Demerol and the thing, and I still never, was really sedated. I was fully aware of everything. It was very uncomfortable, but, anyways, the doctor calls me back, the week, let me sit down, the next week, and she was like, well, we found, your esophagus to be inflamed, and I was like, what is that? Excuse me. And she's like, basically, that's just, what is that, indigestion? Something like that? Wait, what? Acid reflux. And I just thought that was strange because I was like, I've never noticed acid reflux, but if you say it's inflamed, whatever. So she gave me a prescription for Prilosec, and she was like, I'm sure this is gonna fix your nausea. No, it did not. So, as y'all know, I started getting nauseated back mid-July. It is now almost mid-November, and I have been dealing with nausea every single day. There has not been a day that I haven't dealt with it. And also extremely painful ovarian and uterus pain. Very strange. And also run a fever of around 100 every single day. So, I take Phenergan and Zofran. And then, I got a stomach bug. Oh my goodness. Which I haven't thrown up in, I can't even remember when. I don't think the whole time Joseph and I have been married, I had ever had a stomach bug where I threw up. So that was like the first time for that. And I didn't know what it was. I just thought my nausea had gotten out of control and I was just really super sick. But anyways, then, because I ended up having to go to the emergency room, and that's how they found out I had a bug. But anyways, then 2 weeks later I got the flu, and I had gotten the flu shot for the first time this year. So I was pretty not happy about that. Most of you know, but my immune system is terrible. I get sick really easily, and once I get sick, my body takes forever to fight it off. It's very slow in fighting it off, and I normally, it will turn into other stuff, like the flu will turn into walking pneumonia and blah blah blah. So, anywho, that's what's been going on with me. So I went back to my GYN, and I told her, I'd gone to the GI, had the endoscopy, and, been all around the world, and I'm still dealing with this, and now the pain is even worse in my ovaries or whatever. So she was like, okay, are you ready to draw a line in the sand and schedule a laparoscopy? And I was like, yeah, like tomorrow. I mean, obviously I don't want to have any kind of surgery, but, this is just, oh my God, miserable. Like right now, even as I'm talking to this camera, well, okay, let me turn my fan. There it goes. I'm very nauseated, like, while I'm talking to y'all. And I just took a Finnegan, I would say 15 minutes ago. So if I start getting groggy, or if you think I seem drunk, y'all know I don't drink. I haven't drank alcohol in like 5 years. But that's what it is. It's the Finnegan making me groggy. But yeah, so in the morning I'm having a laparoscopy. They think I have endometriosis, and she's gonna also check my fallopian tubes to see, like, run the dye through them to see what that looks like, to see if they're clear and everything, because infertility problems. So yeah, my surgery is I have to check in at 11:30, and then my surgery is at 12:30. And I asked the nurse when she called today to pre-register me. I told her I was so nervous. I told her I'm just a really nervous person. I have a lot of anxiety, and I asked her, I was like, is there anything that y'all can give me, like a pill, like orally, before I even get an IV? And she's like, yes, we have a few different options. We'll give you something right when you get there. And so it made me feel a lot better. But for some reason, I have this fear, and I don't know why, but I have this fear that, like, I'm not going to be able to go under anesthesia, and I'm going to be, like, awake. If y'all have ever seen that movie, it's called Awake, and it's about a guy who is completely paralyzed, but his brain, like, he can feel everything, and oh my God, I'm, like, totally so nervous that that's going to happen to me. Like, I'm not even kidding. I'm, like, so nervous. So I'm dealing with that, so that's always fun. But hopefully they can, if it is endometriosis, I did do some research on it, found out what it is, and it kind of disgusted me. It's like scar tissue. You can Google it, but like, it can start binding your, that's a Band-Aid right there. I have like a weird thing from the endoscopy. They go through your throat. It just made like a bump. I don't know. Anyways, it's healing. But I don't even remember what I was saying, seriously. Yeah. Oh, anyways, yeah. So the laparoscopy is at 12:30 tomorrow. It lasts about 35 to 45 minutes. Endometriosis. Oh, that's what I was saying. Scar tissue can, like, bind your organs together, and basically these symptoms are painful intercourse, or pain after intercourse, weird periods, heavy, whatever, infertility, pelvic pain, ovarian pain, nausea, vomiting, bloating. I have every single one of those. So, we're pretty sure we know what it is, but I have to get a diagnosis. And then hopefully they can, like, zap that crap out of there, burn it off, whatever they got to do, and I will be good to go. Because I cannot tell you how ready I am to be not nauseated. I mean, it is like, I'm starting to tear up, but it's because of the fan. But, hey, Fifi. Yeah, so right now I'm actually, y'all know I've been temping for the past 5 to 6 months, and right now I'm actually in between jobs, so it's the perfect timing for this to be happening, for the surgery, and for me to be sick, because I'm not missing any work, because I hate missing work, and I'm ready to get back to normal life. I mean, every time I even go to Target, 10 or 20 minutes, I've got to take a Zofran, something for my nausea, because I'm gonna throw up. I get, like, hot, and it's just awful. But yeah, anyways, that's how I'm doing. My weight, I haven't gained, I haven't lost. I fluctuate between 159 and 162, size 8 or 9, 10. And then in the shirt, I'm in between a medium and a large. So I can wear a medium or I can wear a large, but a large is a little big. So, yeah, and my hair is growing like a weed. Oh my God. It's like out of control. And it's not, it's just, this is like, I haven't washed it in like, I'm not going to tell y'all, it's been a few days. So. But, yeah, and it's not curled, so don't mind the way I look. I look awful. But, anyway, so that's the update. I wish I was more cheerful, but I'm one of those top people that I'm not good at faking stuff. Like, there's seriously not many people I don't like, but if I were to come into contact with someone I didn't like, I can't, like, just pretend like I love them, or I can't even pretend like I like them. I'm not a good liar, faker, or whatever. So, what I'm trying to say is, like, I seem kind of down in this video, and that's because I'm not going to fake like I'm, what's up, hey y'all, if that's not how I'm feeling, which y'all know, I feel that way most of the time, just not lately. So, if y'all would say a prayer for me that everything goes well tomorrow, and I will update y'all soon. And yeah, I love y'all so much, and I will talk to y'all later. Bye.